We all know that communication is extremely important, and it can be broken down into verbal communication and nonverbal communication. According to Dr. Albert Mehrabian, the proportions of communication are split into 7% spoken words, 38% voice and tone, and 55% body language. Although spoken words only account for about 7% of communication, they're the way that we actually share our thoughts, feelings, establish relationships, etc. It's critical to understand the effect of the spoken word and how we can strive for more effective verbal communication to convey our thoughts while minimizing misunderstandings. So today I'm focusing on verbal communication, and I will be covering things such as person-centered communication and awareness of abstraction, which are ways to enhance verbal communication. Additionally, I will briefly touch on how language defines phenomena. Lastly, I will end the presentation relating these concepts within verbal communication to my career field of interest, pharmacy. So, the first way to make verbal communication more effective is through person-centered communication. So what does this mean? Person-centered communication means that the speaker adapts their communication to fit the specific intended audience. For instance, the language that a pharmacist uses when communicating with colleagues will be different than when talking to a patient. The first supporting source was titled Person-Centered Communication Between Healthcare Professionals and COVID-19 Infected Older Adults in Acute Care Settings. This study took place in Wuhan, China from January through April of 2020, which was the beginning of the COVID-19 outbreak. The participants were 8 physicians and 8 nurses who were involved in 2 rounds of interviews. The interviews assessed the levels and strategies of care and communication during these new and challenging times. Many of the participants stated that without even realizing it, they were actually demonstrating person-centered verbal communication. An example from one participant stated the benefit of focusing on the important meaning of the information, using plain language, providing reminders to aid memory, and speaking clearly with a higher volume. Another participant shared that for some older adults, you need to speak gently and calm them. For some other older adults, you need to sound very confident and assuring that you can ease their anxiety a bit. Therefore, this demonstrates the effectiveness of using person-centered communication, especially in healthcare settings. The second supporting source involved implementing a new program in the NICU of a hospital called Guided Family-Centered Care. This program was compared to the traditional standard care through qualitative interviews of families with children in the NICU. There were 12 interviews with 22 parents conducted 3 to 6 months after being discharged from the NICU to allow for long-term retention data. The overwhelming majority of parents were satisfied with the verbal communication within the new program, largely for 3 reasons. The first being discovering and expressing emotion, the second, deeper level of communication, and third, mutual understanding. These elements of tailored communication to the families made them feel comfortable, understood, and more confident in their difficult decisions for their child. By having healthcare professionals use this person-centered communication strategy, it helps the patient's experience while also improving the ability of the doctors to do their job. The second way to make verbal communication more effective is by increasing the awareness of abstraction levels. Abstraction demonstrates that words are not the literal object or idea, but instead the representation of it. Increasing the level of abstraction can lead to more misunderstandings since the intent of the message is harder to comprehend. So this again shows that greater abstraction is a greater opportunity for confusion, and this is because it can lead to overgeneralization. So realizing the level of abstraction that we use when we're speaking can actually lead to more effective communication because then we are able to limit it. So the supporting source was about a parent's direct versus indirect verbal communication with their child. The paper states, direct speech occurs when a speaker communicates only and exactly the content uttered. Parents may communicate directly when they want to send efficient and explicit messages. Indirect speech occurs when a speaker communicates anything beyond the literal meaning of the utterance. So indirect communication was stated as being used for a face-saving strategy, which is a form of politeness that can vary by culture. This mode of communication can also be used when talking about emotions. There is a higher level of abstraction when using indirect communication since it is not detailed and to the point. However, there are situations where this form of communication may be more effective in generating the wanted response by the recipient, which in this study was the child. By recognizing the level of abstraction we use in verbal communication, we can adapt based on the situation to increase the effectiveness. The third factor to discuss is how language defines phenomena. This signifies that words are used as a means of definition, and then you actually create the meaning. Words can define things such as thoughts and feelings, which we cannot really be communicated in other ways. This use of definition can lead to creating labels. This means that there is extra attention to a single attribute of personality. Defining people can be destructive, like for instance by totalization. Totalizing means to focus on a single label as if it represents the entire person. There is more to people than one label, however, by totalizing you are limiting that. An example of this is found in a study about the satisfaction of women in labor and delivery rooms based on the communication of their healthcare workers. The women were interviewed after their care in the hospital, and their experience was based on the verbal as well as nonverbal communication by personnel, such as their midwives. The large majority of women were not satisfied with their care based on the healthcare workers' communication. This may signify that there needs to be improvement for healthcare workers' communication with their patients, which could be implemented by person-centered communication, as I previously discussed. Additionally, the study found that women who were young, had a low education level, and/or lived in rural settings reported discrimination and unfriendly behavior from the midwives more often. This could represent totalizing by the healthcare workers, focusing on one label of the patients and using it to represent their identity and leading to mistreatment. The second source shows another study demonstrating how language defines phenomena, which was about measuring the loyalty of patients to a pharmacy. The study was conducted by having patients interview with different pharmacists at different pharmacies, and then having the patient fill out a survey based on their experience. Their experience would determine if they would return to that pharmacy or not. The overwhelming majority stated that they would not want to return, which demonstrated a low level of pharmacy loyalty. Since their experience was a reflection of the pharmacist's communication skills, it may reflect a need for better strategies. From the paper directly, it stated, contrary to common professional beliefs and practice orientation, it would appear that pharmacists' technical skills are not the essential factors that promote patients' loyalty, and that pharmaceutical care education should focus on relational skills as much as on medication-related competencies. This shows that the words we choose to define things matters and may have a lasting effect on people to determine factors such as loyalty, overall experience, or level of care. Now let's discuss how each of the concepts of verbal communication relates to pharmacy. The first being person-centered communication. This is an effective and beneficial strategy for pharmacists. There is a lot of information on drugs and protocols, yet it is critical to put them in terms that the patient would actually understand. For instance, a pharmacist would use different language when talking to a colleague versus a patient. In pharmacy, it is necessary to limit abstraction. To achieve this, a pharmacist can use direct verbal communication that is concise and explicit when giving instruction. Therefore, there are less opportunities for misunderstandings with important information like when, how much, or how often to take a medication. It is critical that the patient is comfortable and confident in how to administer their prescription in order to receive the proper therapeutic effect. Pharmacists should focus on the words that they use to communicate, especially with patients, in addition to other healthcare workers. The language we choose can have a lasting effect and can cause misunderstandings if not done properly. As a healthcare professional, they must limit totalizing and treat their patients with care and use effective verbal communication skills to ensure a good and safe experience for their patients. Verbal communication is very important for sharing thoughts, feelings, instructions, etc. It is dependent on the words we choose to define elements. To ensure effective verbal communication, it is beneficial to use person-centered communication. By adapting language to the audience, they can better understand the content being conveyed. Another strategy of effective communication is to recognize the level of abstraction. This varies based on the situation, so it is critical to notice if it's better to use direct or indirect communication to yield the desired results and be understandable to the audience. We must notice and be mindful of the words we use as definitions and defining methods, like labeling and totalizing. Each of these concepts relate to pharmacy and can help pharmacists achieve better verbal communication skills, especially with their patients. It's essential for patients to know how to properly use the medication as well as feel comfortable and confident in their abilities. This is largely due to the communication of the pharmacist and will help patients have a better experience and trust their provider. This is my bibliography of all the sources from this presentation. Thank you for listening.